Welcome to the first event in the systems stream of the 2022 Healthy Working Lives seminar series, focusing on the transition study. There will be 2 free seminars between now and August to coincide with the release of our other reports. In the spirit of reconciliation, we acknowledge the traditional land custodians of the country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. My name is Dr. Michael Di Donato from the Healthy Working Lives Research Group at Monash University, and I will be your MC for today's event, Transitions to Centrelink After Long Workers Compensation Claims. In today's seminar, we have Professor Alex Collie and Dr. Daniel Griffiths, both from the Healthy Working Lives Research Group at Monash University. Alex is an applied public health and social policy researcher with a focus on work disability, workers' compensation, injury recovery and rehabilitation. He leads a number of large multidisciplinary and multi-institution research projects focused on improving worker health, supporting return to work and preventing work disability. As well as leading a very talented research team in the Healthy Working Lives Research Group, Alex holds an Australian Research Council Future Fellowship and is the current president of the Scientific Committee on the Work Disability Prevention and Integration for the International Commission of Occupational Health. Dr. Daniel Griffiths is a postdoctoral research fellow in the Healthy Working Lives Research Group. His research focuses on improving quality of life, wellbeing and health of workers. Dr. Griffiths' research encompasses longitudinal cohort studies, investigating health impacts of work loss during the COVID-19 pandemic, and studies on the health and mobility of older Australians. His areas of interest cover approaches to manage workers' mental health and evaluating the health consequences of the pandemic response, including lockdowns, return to work, and COVID-19 testing and vaccination. There will be a Q&A at the end of this session, and throughout the seminar you could submit your questions via the Ask a Question button below your live stream. For now, I will hand over to Alex.
Thank you, Michael. It's wonderful to be here today to be able to share first findings from this project that we call the Transition Study, which has actually been many years in the making. This is a project that we began prior to the COVID-19 pandemic and continued throughout. And it's only now, a few years later, that we're in a position to be able to share some of the early findings with you all. So thank you for watching. Now, a project like this takes a lot of people and a lot of organisations, and it will probably become very clear why so many people and organisations have been involved in this as we go through. I really should acknowledge Michael and a number of other academics who've been involved as researchers on this project. Particularly, I'd like to point out the role that Tyler Lane at Monash University has played in the first few years of this project, and our investigators across Monash and internationally as well at the Institute of Work and Health. And it will also become clear as we go why there are so many organisations listed here. The primary organisation that has really supported this, both with data and with some financial support, is the State Insurance Regulatory Authority of New South Wales. Thank you very much to Sarah. But there have also been a number of other Commonwealth and state level organisations involved in what has been a rather complex data linkage process, and they're listed here on this slide. So thank you to those organisations as well. Now, we've published a bit of information from this study already. So before I get into the rationale and background for the study, I'd just like to point you in the direction of some documentation in case you're looking for more. The study protocol was published about a year ago in the International Journal of Population Data Science, and I've included a link to that open access protocol here. And just today, we've released the full report of the findings that you're about to hear more about. You can download that from the Monash University open access site. There's a link here, but we've also posted it on the platform that you're viewing this through. You should be able to scroll down from the live stream and actually download the document as we're going. But don't take your eyes off the screen for too long, because there's some interesting stuff coming up. Okay, so why study this area? Well, we know this is data from the Australian Institute of Health and Welfare National Burden of Disease Study, showing the years of healthy life lost due to disability by age group. And what I've done here is highlight between the two dotted lines the period that we would consider to be working age, so between, say, the ages of 15 and 70, and also highlighted the two major conditions that are burdens of disease or cause life loss to disability in Australia, being musculoskeletal conditions and mental health conditions. And so really a very brief summary of this is that amongst people of working age in Australia, we have these two sets of conditions that cause a lot of disability. And they happen to be the two things that we see quite a lot of in our workers' compensation schemes, particularly musculoskeletal disorders, but increasingly mental health conditions as well. And so by working within our workers' compensation schemes to prevent disability from these conditions, we really have an opportunity not just to influence what goes on within those schemes, but also to influence the population burden of disease. And that's really one of the motivations for working on projects like this, is that we're not just seeking to influence what occurs within our workers' comp systems, but we think we can also have a broader impact across the population. Now, a few years ago, our research group published a study where we looked at this jigsaw of income support that we have for people who are experiencing work disability after an injury, an illness, or a health condition. And this is just a slide that attempts to sort of summarise what we spelt out in a lot more detail in the report and the publication that's at the bottom of your screen here. Essentially, the summary is that we have lots of different sources of income support for people who are off work due to a health-related condition, from sick leave provided from employers all the way through to benefits in our Centrelink scheme. Now, some of these are targeted at people who have short periods of work disability, such as sick leave, and some of them are more focused on people who require long periods of time off work when they're ill or injured. What we're doing today is looking at this transition between workers' compensation and Centrelink. So we're really asking the question, what happens to people when they get to the end of their workers' compensation claim? How many of those people go on to receive Centrelink benefits? And then what happens, or how many people go on to some other situation where they don't receive Centrelink benefits? So what we're trying to do is sort of disaggregate one part of this very complex income support jigsaw that we have in Australia. And we know quite a lot about income support in our workers' compensation systems in Australia. Safe Work Australia, in the most recent publicly available data, reported nationally an expenditure of just over $4.5 billion per annum in 2018-19 on income support, which represents just over half of all of the expenditure in our workers' compensation systems for that financial year. We know that most people have very short periods of time away from work and short periods of time receiving income support benefits, just a week or a few days or a couple of weeks. But a small proportion of people account for a lot of the income support payments we see in these systems. So in a paper we published a few years ago, we were able to show, using the national data set of workers' comp statistics, that 12% of all of the claims for time loss in our Australian workers' compensation systems accounted for just over 70% of all of the income support payments in those systems. And we design income support in a way that allows us to both manage scheme expenditure and also is designed to encourage return to work. So we put limits around what people are able to claim in income support. So we cap it at certain amounts. We time limit income support payments in many schemes. We have step downs in our schemes that reduce the amount of income support people receive at certain points in time post-injury. And we control access to benefits in some ways, for instance, by limiting access to people who have certain levels of impairment. And we do this for the two reasons I've listed on the screen here, both to manage the scheme expenditure and to encourage return to work. What we don't know is what happens when that income support stops. There's very little published evidence internationally around what happens to people when their workers' compensation benefit stops if they haven't returned to work. There are a few examples from the United States, 3 studies that we've been able to find. First one showing that people with time loss claims, so claims, workers' compensation claims involving income support payments, showing that those people are much more likely to receive disability insurance benefits later on. There's another study showing that about 19% of people making claims for low back pain received or applied for what's called the Social Security Disability Insurance payment in the United States 3.5 years after their workers' compensation low back claim, suggesting a reasonable number of people are transitioning from workers' comp claims onto the National Social Security Disability Scheme in the United States. And we've also seen some group level studies showing that reductions in the generosity of workers' compensation benefits in the US has been associated in time with an increase in people applying for disability insurance applications. There's one study in Canada, which is nearly 20 years old now, that showed that about 24% of workers who were injured and made a claim through the Vancouver Workers' Compensation Scheme, British Columbia Workers' Compensation Scheme in 1991, also received Social Security benefits in a 7-year time window compared to 10% of people in the community, so a higher rate of Social Security recipients in injured workers than in the general community. But there are some really big gaps in our knowledge. So we don't have, to our knowledge, any studies of this type in Australia, very limited data on the person level. And some of these studies actually measure things occurring at an aggregate level, and we haven't actually really measured directly the movements of individual people between these different systems of income support. Now, we felt that there was an opportunity to do this by looking at a change in legislation in New South Wales that occurred in 2012, which we're going to call the Section 39 legislative amendments. And this, some of you may be familiar with the change in the legislation here. It's called the Workers' Compensation Legislation Amendment Act of 2012. And this legislative reform occurred in response to the state of New South Wales Workers' Compensation Scheme finding itself in a declining financial position, with the actuaries projecting a $4.1 billion unfunded liability in the scheme, which would require an increase of 28% in employer premiums for the scheme to break even. So the government at the time felt that it needed to reform the scheme in order to address this declining financial position. And they made many changes to the workers' compensation system in New South Wales. Essentially, one of the key underpinnings of these changes was to reduce scheme expenditure over time. And some of these were multiple changes to restrict eligibility and also changes in access to benefits and funding for services. And we have published an evaluation of these sort of macro level scheme reforms in a prior paper, which I've referenced here a couple of years ago. One part of this legislative reform was a thing called Section 39, which came into effect from December 2012. And essentially what this section of the new Act did was limit income support to 260 weeks or 5 years as a maximum duration for workers who were judged of having a whole person impairment less than 20%. Some groups of workers were exempt from this, so those with impairment greater than 20%, and workers in some occupations, which are listed here. And the consequence of this section in the Act was that from late 2017, the income support for a group of people who had been on the workers' compensation system in New South Wales for a very long time, at least 5 years, but in some cases 10 or 15 years or longer, stopped. And that was around about 4,000 people with what we will call very long duration claims. Now, those people were able to access healthcare for 2 to 5 years, depending on their circumstances beyond that, but their income support from the New South Wales Workers' Compensation Scheme stopped at around December 2017 or early 2018. And so the question we are able to address by looking at this change in policy that occurred at a very sort of specific point in time is what happens to workers with long duration workers' compensation claims when their workers' comp benefits stop. And specifically, we're interested in what was the impact of this Section 39 legislative amendment on healthcare and on income support and other things for these workers in New South Wales with long duration claims. So this is the focus of the transition study. Now, it's an easier question to answer than it is to ask than it is to answer. And I'll explain why in a minute. So, but here's sort of a diagram that essentially tries to explain what we're doing here. So if you think about someone making a workers' compensation claim, there was these 4,000 people approximately who made a claim sometime before December 2012. Prior to the legislative reform occurring, they would have been receiving the benefits and services available through the scheme in what we'll call the pre-reform period. In 2012, this new legislation comes into play, which time limits further income support to 5 years. And during that 5-year period, this group of people receive a transitional income support payment. So everyone received the same amount. And for most people, it was a higher rate of income support than they would have been receiving prior to 2012, but it was a flat rate. And then from 2017, income support stops. And our question is, what happens after that point in time? And we're interested in a few things. So we're interested in what happens to their income support. Specifically, do they go on to receive benefits through the Centrelink system? And we're interested in their health. And we have some indicators of health through health service data, such as hospitalisation, Medicare data, and medicines use. In answering this question about what happens to them when income support stops, I guess we have a few options. One option would be to try to follow these people up and survey them, which would be a very challenging thing to do. They're a big group. They've been on benefits for a long period of time, and we probably wouldn't get all of them in that sort of study. So the approach that we chose to use to answer this question was what's called a data linkage study. And what we have done, and this is where the sort of complex long-term part of this project comes in, is we have linked data, to our knowledge for the first time, between a state-level workers' compensation system and a number of other systems in society, specifically the Medicare benefit schedule, so our public healthcare system, the pharmaceutical benefit scheme, our social security system looking at Centrelink payments, and also we've linked data to hospital admissions and emergency presentations in the state of New South Wales. And so we end up with this database of many thousands of cases linked at an individual case level, where during the course of the person's claim, we have data on their workers' compensation claim and all of these other things. And then for a period of up to about 10, sometimes longer years before their workers' compensation claim, we have access to data across healthcare, medicine, social security, and hospital admissions. And also for a period after the end of their workers' compensation income support, we have data to access to data from those other systems as well. And so today, what Daniel is going to present in a minute is just this bit here where we've looked at what's happened after someone's workers' compensation income support ends in terms of their access to Centrelink payments and social security. And in future seminars, we will touch on some of the other databases that we've linked here, the healthcare service use and the hospital admissions. But today we're focused on people's Centrelink payments when their workers' compensation scheme ends. And so to our knowledge, this is a fairly unique and very substantial linked data set, certainly the first time in Australia that we've seen workers' compensation data linked to these other healthcare and income support payment databases in Australia. And getting that data linked is a long, complex process that has lots of organisations involved within it. And could talk about this for hours and hours, because it took us about 2 years to get from the start to the end of this process, from the point in time at which we secured the initial ethics approval to run this project until we received the data and started to analyse it and make sense of it. But essentially the process is we start with the workers' compensation regulator in New South Wales, which is CIRA, and they extract information from two groups. So the people in this Section 39 cohort and also an inter-control group of people, and they provide that information in different formats and in a way that protects people's identities to two other organisations, the Australian Institute of Health and Welfare and the Centre for Health Record Linkage in New South Wales. Now, the Australian Institute of Health and Welfare is our primary data linkage agency, and they gather information from Centrelink, Medicare and pharmaceutical benefit systems and match it to data at an individual case level from the workers' compensation system using a probabilistic matching method. And the Centre for Health Record Linkage in New South Wales accesses information from the hospital and emergency department data sets. Those things are transferred into a secure research environment, which is hosted by the Sachs Institute in New South Wales. And we, as the research team, log into that secure research environment. We formally link the now fully de-identified data sets, and we start to perform analysis on those. So there's sort of multi-step process that we go through involving lots of organisations and lots of checks and balances to make sure that we're adhering to privacy controls and that individuals can't be identified as we go through this. What we end up with is a large linked data set of about 25,000 cases, millions of service records. But this is a huge undertaking and not to be taken lightly. So don't try this at home. We've had to get multiple ethics approval, go through the process of getting lots of public interest certificates from multiple agencies to release data to us. As I said, we've got lots of organisations involved. We've had our protocols and our approaches independently reviewed by experts and also technical reviews by the data linkage agencies. I've written here 12 versions of the study protocol, but that's probably being that's probably undercounting the total number because there were versions of versions. So it's been a long effort to get this data linked. Just a little bit from me before I hand over to Daniel, who's going to take us through the findings. I'll just describe the study groups and the outcomes that we're looking at. So at the end of the day, we have three groups in this study. We have a group of people we'll call the Section 39 group. They're the group we're most interested in. Now, those people are aged between 18 and 67 years at the time their income support ended due to that legislative reform I mentioned before. And they all had an accepted workers' compensation claim lodged sometime after the beginning of the modern New South Wales workers' comp scheme in the late 80s and closed towards the end of 2017 and early 2018 when that Section 39 amendment became effective. We know these people have all had at least 5 years of income support payments through the workers' comp system. Many of them had more than that. We also have a group of injured workers who are acting as a control group. And these people also have long durations of time receiving income support, so at least 2 years, but they're not members of the Section 39 group. So this is a comparison group so that we can help us make sense of what we're seeing in the Section 39 group. And then we have a third group we'll call the community control group, which are people who are matched to the Section 39 group on age, sex, and where they live in New South Wales. But to our knowledge, they have not had a workers' compensation claim, and they're not a member of either of those other two groups. So again, they're a comparison group that allows us to make sense of what we're seeing in the Section 39 group. And in the total study, what we're doing is measuring multiple outcomes. We're measuring Centrelink payments, hospital service use, healthcare services, and medicines. And amongst the sorts of Centrelink payments which we're going to focus on today, we're looking at multiple different things such as unemployment benefits, disability pensions, and others. So today, Daniel will talk about what we've observed post cessation of income support on Centrelink payments, but in our future seminars, we'll be talking about some of these other outcomes, I should say. So I will pause there, and this is the point at which I'll hand over to Daniel, who will take you through what we've actually discovered in this first analysis from the transition study.
Thank you, Alex. I'll be taking you through some of the findings of the first report from the transition study focused on Centrelink outcomes. Some of the research questions we tackled are listed here. So we describe a little bit about who were the people that were affected by this 5-year limit on workers' compensation under Section 39. Today, I'll go through in some detail the research question about looking at the proportion of people who transitioned to Centrelink within 1 year after their workers' compensation benefits stopped. We'll also look at the major types of Centrelink benefits received and factors associated with people that either went on to transition to Centrelink income support benefits compared to those that did not. And finally, we'll touch on some of the timing of Centrelink payments from the final payment of the workers' compensation system to the first payment of a Centrelink benefit. So today's presentation focuses on Centrelink outcomes, and they're described here. So the main focus is whether a person post-claim went on to receive something we've called an income support payment from Centrelink. There are a really long list of different types of income support payments available. But the things that we're not considering here are things like supplementary payments or family tax benefits. We're considering things that are intended use primarily as an income support payment. So as I go through listing some of these, I want you to think about somebody that has a very long workers' compensation claim and how these might fit into their needs after their claim ends. A few of the main ones are listed here. There's the New Start allowance, now called Job Seeker, the main unemployment payment. It's the main payment for somebody looking for work, and it's also for when people are sick, injured, and can't work for a short time. These are the definitions Centrelink provides. Next is the disability support pension for people with a permanent physical, intellectual, or psychiatric condition that stops them from working. There's the carer payment for somebody giving constant care to someone with a severe disability, illness, or an adult who is frail aged. And finally, there's the age pension, the main payment for people that are aged now 66.5 years old. So our outcomes for people after their workers' compensation claim ends, we'll look at whether people received at least one of these regular basic payments of these types during the 12-month period after their final workers' compensation weekly payment. Who did we include in the study? As Alex mentioned, we received workers' compensation records for 2 study groups from CIRA. The Section 39 group, that group that has at least 5 years of workers' compensation whose benefits ceased under Section 39, an injured control group with at least 2 years workers' compensation claims, and a community group that, to our knowledge, have not had a workers' compensation claim. During that complex linkage stage that Alex mentioned, we were able to link a large proportion of the workers' compensation claim records to records by the Department of Social Services. We were able to link 97% of people with long duration workers' compensation claims in our sample to the other data set, so we could reliably calculate whether people had transitioned to Centrelink or not for 97% of the people there. We added in a few eligibility rules. Some of them are linked to the study group definitions. So we required people in the Section 39 group to have their benefits cease after that legislation had come into place. We needed them to have attained at least 260 weeks, that 5-year limit. And finally, we required them to have a 1-year follow-up period where they were not receiving workers' compensation payments. That allowed us to look at that 1-year follow-up period to identify whether they were receiving Centrelink payments or not after their workers' compensation payments ended. Similar sort of eligibility criteria applied to the injured control group. There was an additional rule there, which was that we excluded individuals whose claims, workers' compensation claims, ended prior to 2012. 2012 saw a range of changes to the workers' compensation system, as Alex mentioned, but also to Centrelink. And perhaps most notably, post-2012, there was a restricted access or eligibility for the disability support pension, which was one of the main outcomes we wished to measure. So by applying that rule, it provides a more fairer comparison between the Section 39 group and the injured control group in terms of Centrelink outcomes. This required people to have key demographic data, like age, gender, for example. Resulting from all of that, we still had decent sample sizes for each of the study groups, just under 3,000 people in the Section 39 group, around 4,000 people in the injured control group and just over 10,000 people in the community control group. This slide shows some of the main findings from report number 1. So the main take-home message here, or the key result, is that first bullet point corresponding to the large black bar in the chart. We found that 60% of people whose workers' compensation stopped under Section 39 received a Centrelink income support payment within 12 months. That's a very large amount. So of every 5 people whose benefits stopped under Section 39, that 5-year limit, 3 of them were receiving Centrelink payments to support their income or income support payments within the subsequent year. There's also a large bar for the after workers' compensation period for the injured control group there. We found that 42% of the injured control group received at least 1 income support payment from Centrelink during the year after their claims ended. In the community control group, we can see from 1 year to the next, there's very little change. A very small increase, which we'll see is attributed largely to people retiring or reaching the age pension age. And the community control group do not have a workers' compensation claim, so the before and after period for those two are matched to the time period of the Section 39 group. So what we see here is the community control group show that receipt of Centrelink is relatively stable from 1 year to the next. We see a huge effect of workers' compensation claims ending or after the final wage replacement payment is received for the Section 39 group and the injured control group. There is a huge transition onto Centrelink. The white bars show that a small proportion of the sample were also receiving Centrelink income support payments during the year prior to their final workers' compensation payment. 7% in the Section 39 group and 14% in the injured control group. So the odds of transitioning onto Centrelink from 1 year to the next centered around that final payment of workers' compensation was 25 times greater for the Section 39 group compared to the community, and still 5 times greater for the injured control group compared to the community. So we're seeing really very significant and high levels of transitions onto Centrelink. So of that key message of 60% of the Section 39 group transitioning to Centrelink, we found that 41% of those were receiving the New Start payment, the New Start allowance, the main unemployment benefit. So during the year after workers' compensation claim ended, 41% of the Section 39 group went on to receive at least 1 New Start payment, 16% of the injured control group. And again, in the community control, we see relatively small change from 1 year to the next. It's basically flat. During the year prior to workers' compensation claims ended, again, in white, we see small proportions of people with workers' compensation claims receiving the New Start allowance payment. That transition between the white bar and the black bar for each of the injured groups, the Section 39 group, is very dramatic. It corresponds to an adjusted odds of 80 times greater for the Section 39 group compared to the community, and is also elevated for the injured control group. They're really big effects from 1 year to the next. Finally, we're going to look at the disability support pension. Within the Section 39 group, this corresponded to 19% of that cohort received the DSP within 1 year of their claim ending due to that 5-year limit rule. We also see 8% of the injured control group receiving the DSP within 1 year after their claim has ended. In the community control, again, similar message, it's relatively flat. During the year prior to the claim ending, in white, we see small levels of people also receiving the DSP prior to their claim ending. Taken together, you can see that large transition from 1 year to the next in the Section 39 group into Centrelink from the workers' compensation system. and the same in the injured control group. But overall, the levels of receipt of DSP are much lower than the New Start allowance. Finally, reached the age pension. So the age pension was most common for members of the injured control group, people with claims lasting at least 2 years that ended for reasons other than the Section 39 rule. One of the reasons could be that the workers' compensation system focuses on supports for people of working age, so that retiring out of the system or aging out of the system is in some ways a natural transition to Centrelink. And we can also see aging in the other groups similarly from 1 year to the next, even the community control group. This figure shows Centrelink payments received just by that Section 39 group that were affected by the 5-year limit on their workers' compensation. So this time series shows the period of time 12 months before workers' compensation ended in the center of that figure, the moment that people received that final income support payment from the workers' compensation system, and 12-month period afterwards. You can see this dramatic wave of uptake of fortnightly Centrelink payments centered near that final payment date in the middle of the figure. And you can see that the quick uptake of the New Start allowance in red, disability support pension in blue. You can see the scale of the age pension and carer payment much smaller, and a long list of other potential income support payments, relatively small contributions there in purple, if you can even see them closely. So the ones we've looked at are very much the main types of income support payments received. During the 12-month period before, we can see that the major contribution of Centrelink payments are the DSP in blue. We know that the monetary value received is much lower than afterwards, coinciding with the withdrawal of workers' compensation payments. This figure also shows the large gap of people within the Section 39 group that don't transition to Centrelink. We don't know too much about them, but at any given time, 50% of the people in the Section 39 group post-claim were not receiving any Centrelink payments. So we know that 40% never received Centrelink payments at all during that period. I touched a little bit on the timing of Centrelink payments post-workers' compensation. What this shows here is something that may be unsurprising to people familiar with the application process for the New Start allowance and the disability support pension. So what this shows is within the Section 39 group and the injured control group, the first graph there shows of the subgroup, the 100% of people that went on to receive New Start allowance, that those transitions were relatively fast. People received their first payment of New Start allowance within a month, roughly, for each of the study groups. Compared to the disability support pension, you can see that rate is much, much slower, taking at least 3 months or 5 months. And that trend there doesn't look like it's leveled off in the same way that the New Start allowance has. So we may expect further transitions to the disability support pension beyond the study follow-up period. So we've seen a wave of individuals transitioning or receiving the New Start allowance and a smaller group receiving the disability support pension. So we looked a bit into who those people were, and we found there are a number of characteristics associated with these people that meant they were more likely or more commonly in our sample to receive each of these types of Centrelink benefits. For the New Start allowance, we found that the payment was more commonly received by men, people aged 55 to 64, people that were unpartnered, living in more disadvantaged areas or outside a major city, or people that were non-homeowners. For the disability support pension, we saw some similar patterns. Disability support pension was also received more commonly by people born in Australia, people with longer workers' compensation claims, and people with compensable head injury claims, and were less commonly received for people with an upper limb compensable injury. So what do these mean? Well, we know that some of these things align very closely with the eligibility rules for each of the payments. So both are income and asset tested. So we know that if people have a partner earning an income or own their own home or have a certain amount of assets, that they will more likely be ineligible for these payments. So we know that the people who did not transition to Centrelink are more likely to have these, more likely to not meet the asset testing rules. The disability support pension, longer claims may indicate poorer health or a deterioration in health, and compensable head injuries may speak to the severity of injuries in that location compared to an upper limb. The one thing I want to highlight here is that whilst 100% of the Section 39 group were eligible for many years of workers' compensation benefits for a work disability, only 19% were eligible for the disability support pension or applied and received it. And just to acknowledge that these are two completely different income support systems with completely different eligibility rules and terms of assessment. So to conclude, taking you back to that 60% figure of the Section 39 group that transitioned to received Centrelink income support benefits within 1 year after payment stopped, we can see that this rule triggered the movement of the majority of people from the workers' compensation system to receiving Centrelink income support payments, mainly the New Start allowance and half as many to the DSP compared to the New Start allowance. We can see that these sort of system level policy changes are likely to influence the health, economic and social impacts more widely, and they should be considered when in situations where people are moving between different systems of income support, particularly for people who have been out of work for a long time due to an injury and may remain unable to work for a long period of time. So taken together, it shows really the importance of supports that are needed to assist transitions to Centrelink or to other forms of income support after workers' compensation claims end, particularly in the case of time or duration limited compensation. So some implications. The first listed here is to recognize, firstly, that many injured workers transition from the workers' compensation system onto Centrelink. While the system's designed to encourage rehabilitation and return to work, the data we've shown here is that the outcome is not what's experienced by many people that we've looked at in this study. A range of transitional arrangements were put in place as Section 39 came into effect, including early applications to Centrelink, where these people could apply to Centrelink 13 weeks in advance of their final payment. We can see that these sort of supports and rules would be beneficial much more widely. For instance, the members of the injured control group illustrate that. Some things that may be more relevant to the workers' compensation system is to encourage supports to prepare people for life after workers' compensation ends, particularly for people who are unlikely or unable to return to sustained employment. And some of those things that we recommend here are financial planning. That might include those early Centrelink applications or support with those processes to ensure timely receipt of income support payments. It may incorporate financial planning for people that are ineligible for those forms of benefits and may remain unable to work for a long time. And also a few years down the line, as the workers' compensation coverage is withdrawn for or removed for health services, plan people to support their health needs after that happens. Overall, this report and our findings speak to the importance of dedicated transitional supports to support the health and welfare of people after long periods of work disability and after their claims end. There's also an opportunity for preventative approaches. So if possible, or in some circumstances, may be able to prevent people from getting into this situation, from having these really complex or long duration workers' compensation claims. It's really important to emphasize the importance of early return to work and rehabilitation interventions where possible. I'd like to acknowledge the co-authors on the report and the people that put the study and the findings together. That's the end of my part. So the next step will involve a brief break and a question and answer session. So please get your questions in. Thank you.
Fantastic. Welcome back, everyone. We have a Q&A session now. So if you have any questions for Daniel or Alex, please just use the Ask a Question button below. But I'll kick off the questions myself. So this study was conducted specifically in New South Wales. For our international viewers, a single state in Australia. Daniel or Alex, can you comment on how or if these findings are relevant to workers' compensation in other states? Or are they transferable findings or generalisable findings elsewhere?
Sure, great question, Michael. I'll have first go at that, Daniel, if that's okay. I'm happy for you to add anything. I think to some extent they are transferable. I'm not sure they're generalisable, but what we have seen in Australia over the last 5 to 10 years across multiple of our states and territories has been a move to what we might call short tail workers' compensation systems. So what we're reporting on here in New South Wales, we're putting time limits on income support that affect thousands of people is an example of that. But similarly, in South Australia, we've seen some pretty significant reform of the workers' compensation system, which has time-limited access to income support to 2 years. And we already have in place in multiple other states and territories similar time limits where most people, if they are on workers' comp for 2 or 2.5 years, unless they are very seriously incapacitated when they reach that point, their income stops. And so, it's not wrong to say that probably Australia-wide we have thousands of people with 2 or more years of income support under a workers' compensation scheme whose income support stops, who have not returned to work when that happens. And so, this is not a small issue. There are many, many people being affected by this. So the general pattern that we're observing in this is probably also occurring in other states, I would suggest. The sort of precise numbers, obviously, we don't have anything more precise in other states apart from what we have in New South Wales. But I would expect if we repeated this study in Victoria or Queensland or Western Australia or South Australia or wherever, we would see similar things.
That's really interesting. I was just thinking as well, as Daniel mentioned, there's kind of 40% of people who didn't go into Centrelink, or effectively we don't know about these people. And so really, of those 40 to 50% of the Section 39 group, do we know anything about those people who didn't go into Centrelink?
By looking at the people that did go to Centrelink, we can infer a bit about the people that didn't. We can see that they're less likely to meet those eligibility criteria for Centrelink. So they may be more likely to be relying on a partner income, or have assets that mean they're ineligible for Centrelink. So I think that probably speaks to them being put in a tough situation where there's the system is designed in some ways for you to rely on those assets. So it really speaks to the difference between the workers' compensation system that is replacing a wage that is lost due to an injury, and the Centrelink system, which is more needs-based. So what is the capacity of you to look after yourself? And so I think those 40% or 40 to 50% may in some ways also be in a different type of challenging situation where they're expected, or they may have to rely on a partner's income or family or alternative supports if they're ineligible. Some may also return to work, or we're not too sure. It'd be great to link up some additional data sets or to get some more information about those people.
Yeah, I think Daniel's right there. I mean, for us to really know more about that group, we'd probably either need to link some other data sets in. We do know some things about those people, and this will be revealed in future seminars. We know some things about their health service use, and the other things that we're able to measure through those other data linkage, other aspects of this data linkage component. But in terms of where their income support's coming from, we know very little, apart from that they're not receiving Centrelink. We can also comment, I think, about the amount of income that has been lost in all of these groups. So because there was this transitional rate that occurred in the Section 39 group for that 5-year period until their income stopped, we know fairly precisely what those people were receiving on a weekly or fortnightly basis. And then it dropped. If they either dropped down to nothing, nothing through Centrelink anyway, or it dropped to the rate of one of those different Centrelink payments, and they're all at different rates. So the unemployment benefit being the lowest, and then the disability pension and age pension being higher than that, but still not a life of luxury on those payments either. In fact, we know that people receiving unemployment benefits and disability pension payments are more likely than not to be living in poverty. And so one of the sort of adverse outcomes we're seeing here potentially that we can infer from this study is that those people who are going on to Centrelink benefits are going to a level of income that puts a lot of people in below the poverty line. And that's sort of a hard thing to accept, but that's the reality of what we're observing here.
I suppose, and I suppose on Centrelink, with new staff, for example, people are typically obliged to be searching for jobs. I suppose, what are some of the other implications of moving on to Centrelink for these workers out of workers' compensation? I mean, I've already mentioned the financial impact. There's some others.
Yeah, you mentioned, I guess the main other one, Michael, is that for most people who are receiving unemployment benefit, there are mutual obligations which involve job seeking. And so those were suspended during the pandemic for a vast majority of people in receiving those benefits. But under sort of normal circumstances, if you're receiving a New Start payment or job seeker payment, you're expected to be looking for work or training and doing other things. There are also some mutual obligations in the disability pension system. So a lot of people who are before they're eligible for the DSP have to demonstrate that they have been looking for work for an 18 months period of time. And that's one of the reasons we think the results that we're reporting doesn't actually show the full transition onto the disability pension. I think if we were following people up for longer, which we hope to do in the future, we'd actually see a larger proportion of the Section 39 group and potentially the injured control group actually gradually moving on to the DSP as they demonstrate that they're eligible for it. But that process of demonstrating and applying for DSP benefits can take many, many months, and we probably haven't seen the full transition of people onto DSP in our data, I think. So the main implications are about those mutual obligations, and then there's the reduction in income. One thing that we'd like to look at, I think, moving into the future as well, is the withdrawal of healthcare. So we know that the workers' comp system, that healthcare remained available to these people. Healthcare for the compensable condition remained available through the workers' compensation system. But one question that we have is how many people access that when their income support stops? So is the withdrawal of income support actually a trigger for people also withdrawing from healthcare funded by the workers' comp system? That's an interesting question. Or did some people just continue to receive healthcare funded by the workers' comp system? You know the answer to that because we've been involved in we've been leading that analysis, but that's stuff that we will present in future seminars. There might be implications for people's health and well-being as well. If, we know that when people find themselves in situations of financial stress, such as having a sudden reduction in your income, that can have health and social and other consequences. Now, we haven't measured those other consequences in this study. We might be able to see some of those things through the health service data that we've linked to. But we haven't measured things like people's personal relationships and that sort of stuff. We would need other study designs to do that, but we could, based on prior research, we could hypothesize that when people find themselves in situations of financial distress or reduced income, that it does have, at least for some of them, those other impacts as well.
I suppose, kind of fairly harrowing stuff for those people that are going through these kind of experiences. Kind of a tangential question, I suppose, on the technical aspects, but there was, data linkage was really used for one of the first times in Australia in this project. And do you think this sort of data linkage approach could help us understand other aspects of injury compensation in Australia? Either Daniel or Alex. Yes. Yeah.
I'll have a go at answering that, Mark. But yes, absolutely. So as I mentioned, to our knowledge, this is the first time that it's been done in Australia. And we found one other example, which I mentioned briefly, in British Columbia in Canada, where data was linked between their workers' comp system and their healthcare system and their provincial income support system as well. But there are very few examples internationally of this sort of thing occurring. And we focused here on a specific group of people who have been exposed to a specific change in legislation. In other work we've shown, and Safe Work Australia data shows that there are almost 250,000 people who make workers' compensation claims every year in Australia. And if you believe the sort of estimates, 10 to 12% of those people have longer duration claims beyond 6 months. Most people we know return to work and get on with life and things are okay, but there is a proportion who struggle with return to work and who are more likely, I guess, to access these other services and systems in society. So this sort of data linkage approach could tell us a lot about that quite significant group of people. We're talking 20 to 30,000 people every year who are having those sort of longer claims in Australia. So yes, we can learn a lot more, I think, if we set this data linkage infrastructure up across multiple systems and more broader groups of people, but that would be an enormous undertaking. It was a lot of work getting this data linked, and the academics, if there are academics and researchers listening, will understand how far behind we are in Australia on some of these data linkage approaches. We have a long way to go. The fact that we have a federation of states and territories really poses some challenges when some services are delivered at a state level and others through a different level of government. Makes this sort of project quite challenging.
One of the other benefits of the data linkage approach is to see how, well, in this example, cost saving or expense saving policy in one area has a flow-on effect both to the individual but onto the federal social security system and also into the healthcare system. So a cost saving in one place, see how that flows on into society and affects the individual.
Yeah, I agree, Daniel. I suppose one way to think of it would be, from a purely economic standpoint, is that the liability is moving from the employer, who's paying the insurance premiums, which then pays workers' compensation, to the taxpayer when people move on to the onto a Commonwealth social security system. Even though their payments are substantially reduced after exiting workers' compensation. The problem doesn't go away. It still continues, and I suppose that's what's been revealed here in this study.
Yeah, well, that's true. That's exactly right, Michael. That's precisely what's happening. And in qualitative studies over the last 20 years, we've heard this a lot from people with long duration claims, is about how they access multiple systems in society. And so to some extent, these findings aren't that surprising. They just demonstrate what we had already been hearing. And in conversations with people who support people with long duration workers' compensation claims, we hear this all the time. And so you don't have to think about the way Australia organises itself with our systems of financial and healthcare support for too long or for too hard to realise that this is likely to occur. And what we're doing here is demonstrating the magnitude of it in a specific circumstance. The way you articulate it then is exactly what's happening. We're shifting a cost from one system to another in one respect, if you look at it purely from that sort of economic point of view.
Yeah, I was thinking as well, I suppose not only are they shifting costs in terms of wage replacement, but also healthcare, which we'll talk about later in another event in this seminar series, is that people are probably accessing multiple healthcare systems simultaneously, or multiple sources of funding for their healthcare through Medicare or through workers' compensation.
Yeah, and let's be clear that accessing Centrelink benefits, particularly when you're unwell, isn't necessarily an enjoyable process. In fact, we've got a lot of evidence now that people find that application process for things like the DSP and for some other benefit types very stressful, and that it alone can have direct impacts on their health. And so this is not just an economic problem. Obviously, it's actually we're requiring people to move from one system to another. We're actually exposing them to a whole set of other stresses, and bureaucracy and administration, which can be very challenging, particularly if the person is unwell and not working and has a history of the sorts of challenges that we see in some people with long duration workers' comp claims.
Yeah. Well, thank you both for the discussion after that presentation. For our viewers, we'll be back in just a moment. Thanks. Thank you all for attending the first event in the systems stream of the 2022 Healthy Working Lives seminar series. We'll be hosting another 2 free events focusing on the transition study, the next one being Wednesday, the 22nd of June. The next event in our seminar series will be next Thursday, 19th of May, from 12:30 to 1:15 p.m. Australian Eastern Standard Time. This event falls under the recovery stream and focuses on the Compare project. The title of this event will be What Happens to Workers with Long Duration Workers' Compensation Claims? And you'll be hearing from 2 speakers, Dr. Daniel Griffiths, who you just heard from today, and Luke Sheehan, both from the Healthy Working Lives Research Group. And we hope to see you then. Thank you.